It's Tuesday, October 22nd, and this is the Daily Medical News, where we bring you clinical medicine's top headlines, plus an in-depth look at today's biggest story. I'm Mary Ellen Schneider.
And I'm Nick Andrews. Today, beta blocker treatment did not top placebo at preventing COPD exacerbations.
Eating disorders may impair type 2 diabetes control.
Half of college women exhibited symptoms of binge eating.
And a once-daily oral JAK inhibitor shows promise in treating atopic dermatitis.
Plus, a large study shows lung function decline continues long after patients stop smoking.
Beta blocker treatment didn't prevent exacerbations in patients with moderate or severe COPD. It's a finding that contradicts previous studies suggesting that beta blockers cut exacerbations and all-cause mortality risk in patients with COPD. Researchers at the University of Alabama at Birmingham conducted a randomized trial of 532 patients with moderate or severe COPD. Patients received either extended-release metoprolol or placebo. The two groups saw no significant differences in median time to the first exacerbation, but metoprolol was associated with a higher risk of severe or very severe exacerbations, leading to hospitalization. The researchers cautioned that their results might not apply to patients with mild airflow obstruction or a lower exacerbation risk. They presented the findings at the annual meeting of the American College of Chest Physicians.
Patients with type 2 diabetes and binge eating disorders had worse glycemic control than diabetes patients who did not have eating disorders. But weight may be a modifying factor. That's according to a study of 70 outpatients with type 2 diabetes conducted by researchers at the State Institute of Diabetes and Endocrinology in Rio de Janeiro. Fasting blood glucose and HbA1c were significantly worse in patients with a binge eating disorder compared with patients with normal eating patterns. But the significance disappeared when the researchers added BMI to their model. Given the findings, the investigators say the remission of binge episodes could play a role in treating type 2 diabetes. The findings appear in the Journal of Eating Disorders.
Approximately half of college-aged women exhibited binge eating symptoms, and those women scored significantly higher on mental health issues than did non-binge eaters. Researchers at An-Najah National University in Tel Karm, Palestine, analyzed data from 154 college women. Overall, 50% of the students showed positive binge eating symptoms. Those students also had significantly higher scores on measures of depression, stress, and anxiety compared with those without binge eating symptoms. Binge eating also was significantly associated with greater frequency of eating between meals and increased snacking, and there was no significant association between binge eating and socio-demographic variables such as marital status and years of study. Binge eating wasn't significantly associated with weight status. The research appears in the Journal of Eating Disorders. We'll be back with more medical news after this message.
Welcome back to the Daily Medical News. I am Nick Andrews. Results from a Phase 3 trial move Abrocitinib one step closer to becoming the first once-daily oral Janus kinase 1 inhibitor approved for atopic dermatitis. In the JADE Mono 1 trial, 387 adolescents and adults with moderate to severe AD were randomly assigned to one of two Abrocitinib doses or to placebo. Researchers from Oregon Health and Science University in Portland presented the findings at the annual Congress of the European Academy of Dermatology and Venereology. There was a clear-cut dose response. The investigator global assessment response rate was 44% in those on the high dose of Abrocitinib and 24% in those on the lower dose. The rate was 8% for placebo. Another important secondary endpoint was the proportion of patients who achieved at least a 4-point improvement in itch on the pruritus self-rating scale. By week 12, 57% of the higher dose Abrocitinib patients had hit that mark, compared with 38% on the lower dose and 15% of the placebo patients. Full details from a sister pivotal phase 3 trial, Jade Mono 2, should debut early in 2020.
Stopping smoking may not stop lung function decline, which appears to continue even decades after patients quit smoking. Smoking prevalence has dropped from 42% to 16% in the past 50 years, and many smokers report that they smoke fewer cigarettes per day. Yet the prevalence of COPD continues to rise, making it the third leading cause of death worldwide. Researchers at Columbia University in New York pooled data from 9 U.S. cohorts with more than 25,000 participants recruited during 1983 to 2016. They found that compared with never smokers, former smokers had a decline in forced expiratory volume in 1 second, about 20% as severe as current smokers. But their decline was higher than never smokers. And low-intensity smokers also fared worse than never smokers. That suggests no amount of smoke exposure should be considered safe. Even after decades of abstinence, the effects of smoking appear to linger. 30 years later, FEV1 loss was accelerated by 0.9 millimeters per year compared with never smokers. The researchers did find a relationship between FEV1 decline and intensity of current smoking. Those who smoked fewer cigarettes per day saw a lower rate of decline than those who smoked more. And that's it for today's Daily Medical News. Remember, you can find the Daily Medical News on Apple Podcasts, Spotify, Amazon Alexa, Pandora, and YouTube. For MD Edge, I'm Mary Ellen Schneider.
And I'm Nick Andrews. Thanks for listening to the Daily Medical News.